Okay, lots of news for the week, but we are going to now jump into our feature articles. We had a couple of really good features this week.
Yes, we did.
And we're going to start with one from Christine Forcier. And Christine Forcier is with Intertek, and Christine is primarily works with Intertek within medical device and cosmetics.
Right, and her article was breaking into major markets for medical device manufacturers.
Thank you. Now she is Intertek's business assurance program manager for, as I say, for medical and the cosmetic sectors. And now this is a topic that we've been talking about pretty often on the show the last couple of weeks. So we've had a couple of articles that have gotten to this, kind of from some different angles. And we're gonna bring Christine on, and we're gonna talk about this and explore those angles and talk about what the process is and how registrars like Intertek help to manage this. So,
exactly.
Christine, are you with us?
Yes, I'm here.
Oh, perfect.
Thank you. Thank you for joining us. We have Christine here via Skype. And yes, thank you for giving up some of your Friday to join us here on Quality Digest Live. Now, Christine, we, as I mentioned to you earlier, have been talking on the show lately a lot about medical device, but from a slightly different angle than where you bring it from. We've been talking about the IEC 60601-1 standard, and you talk in your article about, and you work in your work, you work with ISO 13485. Can you just kind of, so we set the ground a little bit, tell us very briefly the difference between those two standards and what people need to know about them?
Sure, yes. The IEC 6601 standard has to do with electrical product safety. And the ISO 13485 standard relates to the quality management system for medical devices. So one addresses product safety and the other one management system.
So, and your perspective on this again is that you take it from the ISO 13485 perspective. You work to help register and audit medical device companies for ISO 13485, and that's your part of
Exactly.
This. Gotcha. Okay. Well, exactly. Let's jump right into this. Now, can you give us an example of a product that might be considered a medical device in one market, but not another? This is an interesting question that came up. Can you kind of get to that a little bit?
Yeah, sure. Well, a classic example would be a product intended to treat signs of aging. Although definitions of a medical device in the EU and in North America look very similar, the interpretation is different or is applied differently. So in the EU, because aging is not a disease or a medical condition, they would not consider it a medical device. In the US or Canada, these may be regulated as medical devices. And the same product would be regulated as a cosmetic product in the EU.
Well, that brings up a good point. We talk about kind of classification of devices, and that's a very upstream element of this. It's actually, I think the first step is really the classification. Can you talk about why that needs to be done so early and why maybe it can't be done later in the process?
Yeah, that's a good question. Actually, because major markets have adopted a risk-based regulatory system, whereby the level of scrutiny exercised by the regulator is proportional to the risk level of that product. That's why it's important to classify the device early on in the process, because the higher the risk, the more information is required to demonstrate safety and effectiveness. So in other words, the risk class really determines the requirements. Everything flows from that. So that's how you get the conformity assessment requirements imposed on you as a manufacturer.
And what are some common errors that somebody would make in terms of classifying or thinking that they're classifying their device? What are some common hiccups that device manufacturers encounter out there that you've seen?
The most common one I see is that manufacturers often assume the classification in the U.S. applies elsewhere. So, they may have a product classification by the FDA, and they talk about having a Class 2 device when, Class 2 doesn't even exist in the EU system. They have a Class 2A and 2B. So that's when we know that the manufacturer hasn't looked at the classification rules and hasn't determined the classification for that specific market. So this has to be done, the exercise has to be done for every market. Every regulator has a different set of rules. You can't just assume equivalence.
And what's the risk? We talk about risk all the time. What's the risk of that from the perspective not only of the manufacturer, but in terms of the user as well, in terms of not properly classifying it? Is it more of a financial risk, or is it a risk that is in terms of maybe something escaping into the market that shouldn't be?
The risk is more for the manufacturer to experience delays in getting the approval, because if it means that if it's the wrong classification, they're going down the wrong path, so they may not be producing the documentation that's required, and there may be more back and forth than if they start with the right classification and understand early on what's going to be required of them.
There was a really interesting chart that you had in your article, and I encourage everyone out there to read Christine's article, which again appeared earlier this week in Quality Digest. Christine Forcier's article on medical device standards. The benefits of using the 5 steps that were in that chart in terms of major market requirements and looking at them in parallel. What are the benefits of doing that?
The main benefit is to save time and avoid delays down the road. For example, when a manufacturer prepares a technical file, it's easy to address, for example, safety and effectiveness requirements in Canada, EU, Japan at the same time because they overlap. Mm-hmm. So if you develop that technical file, for example, just addressing one market, then later on you have to go back and revise a technical file when it's much simpler to look at those in parallel and create a technical file that will address all market requirements. And the same applies when developing a quality management system. So again, it's more efficient to develop a process that will address all applicable requirements at the same time than trying to add on later.
Now, Christine, as I referenced at the beginning of our interview with you here, we've had a lot of chatter, and we've been covering this issue a lot in Quality Digest, in our newsletter, as well as us here on the show. This idea of medical device requirements, standards, again, more through the prism of 60601-1, but I think it's applicable to 13485 as well, that there's a significant cost factor involved here, and not only the cost of developing medical devices, but at the end of that game where you develop it and then you have to go through the process of ensuring that it's compliant and that it meets a standard like whether it be 13485 or 60601-1. So, there's questions about the cost benefit structure of that. So, how would you address questions which we've gotten about the cost that it takes to have a registrar certify you, make sure that you're in compliance with one of these standards?
Well, the cost, it really depends. It's a case by case. It really, for certification, it depends on the size of the company, but also complexity, risk of the products, how many processes there are. So there are many factors that we consider. There's a mandate table that's imposed on registrars. So that's really the starting point. And that's really what determines cost. But there's also benefits to getting registered. You get the benefits of having an independent party testing your system, identifying risk area. So, maybe it's hard to measure the savings or the value, but there is definitely a cost-benefit analysis to be made by manufacturers.
Absolutely. Well, great. Well, Christine, thank you. We're going to leave it off there, but I really appreciate you joining us here today on Quality Digest Live, giving us your perspective on ISO 13485, a valuable standard, obviously something anyone in the medical device field needs to be well aware of. Right. And certainly we appreciate your expert insight into that, Christine, and we look forward to chatting with you soon and hearing more of your thoughts in upcoming issues of Quality Digest Daily and here on our show as well.
Thank you for having me.
Thank you for joining us. We'll talk to you soon.
Thank you, Christine.
Well, good stuff there. I think that we really get to the heart of some of these issues that a lot of the readers are addressing is why and what the benefit of it is and why you have to. It's not a choice really in many matters.
Depending on your market, there are sometimes you don't really have a choice as to whether you're registered. If you want to go into certain markets, you actually have no choice.
Well, and there is. I think she made a good point of this. There's a significant benefit to that expert third-party analysis of that and making sure that your device meets those standards, because we know, quality escape in this sector is not only potentially harmful, obviously, to thousands and thousands of health consumers, but also financially the burden could be well into the millions.
Right, and I think an issue that we do need to delve into more deeply probably doesn't apply to 13485 so much as some of the other medical device matters is the cost.
Yes,
and I think that is something that we want to pursue a little bit further in the future.
We'll be doing more of it down the line. So
yeah,
it's great.
Okay.